Many people are concerned that using CBD oil for whatever reason may mean that they fail urine drug tests. However, there is a chance that if you use CBD oil properly and you don't use large doses of it, that you could pass the tests with flying colors. Who is routinely tested for drug use? Many workers are routinely tested for illicit drug use in the United States. Regardless of whether you agree that people should be tested, federal employees are tested because the tests are mandatory. Many other employers are bringing out some form of drug testing just to make sure that the people they employ are clean. When drug testing is mandatory, employers have to follow the guidelines set out by the Substance Abuse and Mental Health Services Administration, SAMHSA, as this form of testing is backed up by law. There may be some sort of overlap between the guidelines and the cutoff levels for drug metabolites and the drugs themselves in the testing and screening processes. THC and drug tests. As THC is recognized as being the compound that's responsible for producing a euphoric effect, routine drug tests search for marijuana. These urine tests consist of using an immunoassay with antibodies. An immunoassay is a specific procedure that is used to detect or measure certain proteins or substances. The immunoassay also uses a metabolite known as 11-nor-delta-9-carboxy-THC. In its detection, 11-nor-delta-9-carboxy-THC is formed within the body once cannabis has been used. This means that if you have been using cannabis in any form or taken in any way, it will show up in your test results. SAMHSA has come up with a cutoff level in a urine screen, and the cutoff level is 50 ng/ml, nanograms per milliliter. A nanogram is just 1/1000th of a gram. This ultimately means that if you have used just 1 gram of marijuana, you will fail your drugs test. If you used just half a gram of marijuana and so on, you will fail your drugs test. When greater than 50 ng/ml, a gas chromatography/mass spectrometry (GC/MS) test is used to confirm that the urine screen is positive. The cutoff level for the GC/MS is just 15 ng/ml, as is only used to detect the 11-northuco metabolite. Cross-reactivity and false positives. The good news regarding the THC-COOH is that it has little cross-reactivity to non-intoxicating cannabinoids, such as CBD. This is great news for those who use CBD oil regularly, if not every single day. However, if you were to use more than 1,000–2,000 milligrams of CBD oil every day, your test may come up as positive during the urine screen. Although this very rarely happens, the screen will show a false positive due to the non-THC compounds or metabolites that could cross-react with the immunoassay. If and when a false positive occurs, the GC/MS test will show up negative. This is because CBD and a few other cannabinoids will be undetected by the GC/MS test, which is considered to be more accurate, and it searches for more specific things as opposed to the SAMHSA test, which searches for a wider scope of drugs. You should be aware that most CBD-rich oils tend to contain a lot less THC than marijuana. Hemp, for example, contains 1/10 to 1/300th of the concentration of THC that's found in marijuana. This means that anyone using 1,000 to 2,000 milligrams of CBD oil per day would consume around 3 to 6 milligrams of THC. 1,000 to 2,000 milligrams is a lot, and it would show up in somewhere between 11% to 23% of tests. However, there is some indication that doses of 0.5 milligrams of THC that are taken daily from up to 5 servings of some of the better known CBD oils show that the screen rate is less than 0.2%. This could mean that some of the better quality CBD oils have as much as 600 times less THC than some marijuana products. You may, therefore, wish to consider using some of the better quality brands of CBD oils so you are more likely to pass a drugs test. Hemp-based products and drug tests. Someone who uses a hemp-based product that's high in quality is very unlikely to have a positive urine drug test result. This means they could test less for THC-COOH, THC, or both, which is good news. However, you should be aware that a very high dose of CBD oil could result in a positive screen, even though the GC/MS test would show up false. When it comes down to it, those who use CBD oil should know what their employer's regulations are, and they should, if they need to, adjust their consumption so the urine drug tests come back negative. Please note that SAMHSA's standards have a cutoff level of 50 ng/ml, however other organizations may have different test standards, so you should make sure you're aware of those. If you are concerned about failing a drugs test after using CBD oil, please make sure that you speak to your doctor as soon as you can.